Squares. Let me know when we're live. I see we're live. Well, let me welcome you to our flu education training for our wellness warriors here. And we have two outstanding content experts to talk to us today. And Kenneth Thomas and Blake McGordy, I'm going to have you say your name so the audience knows how to pronounce them. And I want to bring Sandra Murray and Michael Brown into let's go ahead and spotlight them. And we'll begin with our content experts. So Kenneth Thomas, unrelated, or we might be cousins, buddy. You never know.
If you spent time in Western Pennsylvania, it's a possibility, Doc. So my name is Ken Thomas. I am a pharmacist with Walmart Pharmacy. I live in the greater Pittsburgh region and serve communities across all of central Pennsylvania and support through the eastern side of the state as well.
Wonderful. Thank you for being with us here today. And Blake McGordy, and let me hear you pronounce it so we hear your pronunciation.
You were right on the money. It's Blake McGordy. I too am a Walmart pharmacist, and I also live in the Pittsburgh area. But my reach goes into to Ohio, about down not as far as Columbus, but over to Akron and down into most of West Virginia. So although Ken and I do live in the same city, we have he reaches one way and I reach the other.
Yeah, we got two cities that have been mentioned. I lived in Pittsburgh for 10 years, and I'm born and raised in Columbus, Ohio. So we got friends right here. And this is all made possible because of our wellness warriors, our barbers and stylists who have literally turned their places of business into trusted information centers. And both of you would be so proud to know that the two people about to be introduced have literally had needles in arms in their places of business. And we want to make sure moving forward that silver lining of this pandemic continues and is something sustainable. So now if we can deliver a life-saving COVID vaccine in a barbershop and a beauty salon, why can't we give the flu shot there? And that's what we're talking about today. And that's going to be made possible by people like Sandra Jenkins. Hey, Sandra Jenkins.
Hello, good afternoon, everyone.
Tell us where you are.
Yeah, well, I'm from the state of Pennsylvania, the Keystone State of Pennsylvania, and I'm just elated to be here with our Walmart staff that is so committed and so diligent about helping saving lives in Pennsylvania at our salon. I'd like to say that, with that being said, there are many people who hopefully are on board right now that are in the salon that are supporting this webinar with us today.
Thank you. Thank you so very, very much. And joining you here on screen, we have people out there in Facebook that are streaming, and we'll have people watching this in the post-production. We have Michael Brown, the manager of the Shop Spa in Hyattsville, Maryland. Michael Brown, tell us a little bit more about yourself and where you are.
Hello, as I start again, Mike Brown, a certified community healthcare worker by the state of Maryland. I'm also the manager at the Shop Spa right in Hyattsville, about 9 miles right outside of the Washington, D.C. White House. We just take a pleasure and a pride in trying to correct the misinformation in the community. That has been our job, trying to get them to see that you can trust these people, and being the bridge gap in between. It's just been a pleasant journey, and I'm just honored to be here.
So one of the things that we've learned is that the pharmacist is more than somebody behind the counter filling your prescription. The pharmacist is a full-fledged health professional. And you know what about pharmacists? They know how to talk to everyday people. And so I'm going to turn the floor over I'm going to start with Ken Thomas and give you an opportunity to kind of make your kind of opening statement as it relates to why is it important for us to even be thinking about the flu vaccine, and important to bring that information into the barbershops and beauty salons where many people who may be hesitant can be reached and can be served. And with that, Meg Jordan will spotlight you, and let's go ahead and spotlight Ken Thomas.
Thank you, Dr. Thomas. I think we often as pharmacists like to call ourselves the most accessible healthcare provider, licensed healthcare provider that you can find. Because when you walk into a pharmacy, there I am. You see me right across the counter. You can come up and talk to me easily. There's no appointments to come in. There's no waiting rooms. There's no going to wait into another room until you get to see me like other healthcare professionals. And we have built a lot of credibility in our communities doing that and being accessible like that. But when we really stop to look at it, what excites me about today in this group and conversation is that there's another professional that is even more accessible and already more trusted. And that's the entrepreneurs, that's the professionals we have in our salons and barbershops. So it's incredible to see how we are going to be able to partner to talk about the risk of flu and what it means coming off the heels of this enduring COVID pandemic. So if it's all right, I'd like to share my screen real quickly here, just to show two quick maps that I think are telling as to why it's important we're having this discussion today. So give me just a moment. I'm just going to share my screen over here. And this map, and I hope you all can see the map all right now.
Yeah, just put it in slide mode.
So this map is from the CDC, from the Center for Disease Control, and it is basically a heat map of where flu cases are just this past month. And flu hasn't been talked about a lot the last couple years. You can see we're mostly green across the country. That's good, it's positive, but a lot of that is because of all the efforts and all the things we've been doing to protect ourselves from COVID, from mask wearing, hand washing, sanitizing. So as those restrictions are easing, and we're seeing more and more people interact with one another in person again, while COVID cases decline, I want to throw back just for a second to show what it was like before COVID. And you can see the red across our country and the purple even higher. So we had so much more flu activity. And now, again, as we're seeing easing restrictions with COVID vaccines, it's really important we talk about flu vaccine to help protect our most vulnerable community members, our family, our friends. Those same ones that we've talked about for so long being at risk for COVID infection are the same group that's really vulnerable to flu infection, and notably complications like pneumonia and hospitalization or even death from the flu. As that comes to front of mind again, we're just hoping to be able to talk and dispel some of the misinformation that Mr. Brown pointed out to help you talk to your clients, your friends, your family, your communities, and encourage them to get a flu vaccine and stay protected, not just now this spring, but year after year.
That was excellent. The
Yeah.
difference is amazing. So does that mean that the mitigation activities, the washing of the hands, the covering the face actually work to also reduce flu transmission?
Absolutely. The flu virus is transmitted in almost identical ways to the COVID virus through respiratory or air droplets, and then contact with one another or someone that's been sick. So anything from sharing drinks or touching surfaces, again, any of those hygiene things. So it has been a great help in reducing the flu, but the risk now moving forward is, have we taken our eye off that ball, and do we stand at greater risk now, especially those same at-risk folks that we get to spend every day with?
Well, we're going to go into more depth here in a moment, but I want to give Blake McGordy an opportunity to give his opening remarks. Hey, Blake, how are you?
Pretty good. Thank you, Doc. So I'm not going to reiterate what Ken said. I think he covered that all very well. But as being a pharmacist, I was a pharmacist in several different places throughout my career. I was down in Tennessee for a bunch of years, and then I moved up to several different stores in and around the Pittsburgh area. And I found out something. It doesn't matter if I have 1 million things on the wall telling you what schools I went to, how smart I am, what I know about this and that. It's not until I make that bond with my patients do they understand, wow, okay, I'm going to take him serious. He's my friend. He's protected me and my family. Y'all in your communities, in these shops and salons, you already have that. You have the most important part, that relationship. And if you leverage that relationship and start spreading the good information and talking about the importance of these things, you're right on the money.
Well, I'm going to bring some folks up. I'm going to bring Mike Dynamite Brown. Let's bring him in. And he's going to be our first barber into the room, one-on-one with the pharmacist. And Mike, think about the people who sit in your chair, all the things you've heard as we've gone through this pandemic, and even before the pandemic, when it relates to issues of flu. What kind of questions are you hearing from your audience that our guests can answer?
One is, why do I need a flu shot? I've never had the flu before, never gotten sick. Why should I take something that I've never had?
And either one of you, Ken, Blake?
Good, Ken. I'll let you field this one.
All right, thanks. So it's a great question, and it's one that we get commonly. And a lot of younger, healthy adults, they may get the flu virus and not have or have minimal symptoms to it. What we know and what we learned from the last 2 years is that we can put others at great risk, even if we ourselves don't feel too unwell because we have flu or the flu virus. So the flu virus, the flu vaccine will protect, yes, you as an individual, but it'll also help you protect those around you. And that continues to be the case. We can take what we learned the last 2 years and apply it here as well.
So that means, so if I take, so the flu virus is mutating like the coronavirus as well. It gets different strands. So therefore, now once I take one, I have to take one every time it mutates. I have to get stuck again. Is this what you're telling me?
Yeah. So what they do is every year, viruses sometimes change. They can year to year, season to season. What you see prevalently in the communities changes, and they do a lot of research. There's a bunch of people out there that do a lot of work in collecting data from like Australia and things that might get into their season a little bit before us. And they look and they say this is the most prevalent strain that we might see. So they tailor every year. Every year they're going to tailor a flu shot specific for what they expect to show up in our communities year in, year out. So although you did have a flu shot 5 years ago, that's not still around to offer you the protection about what's going to be going on in this next flu season.
The next question was, as you, wait a minute, it just ran off of my brain real quick. Go ahead and come back to me.
So let me do this on that one, and for either one of you to reiterate that the flu, we don't call the flu a pandemic, but it is worldwide. Help us understand something that's global, like the flu, but we don't. Do we call it a pandemic? And kind of repeat the question to set it up.
We move into a term called endemic, which is just the technical way of saying we're not as surprised by this thing now, and we know how to live with it, and we can reduce risks with something like a seasonal flu vaccine. So that's the big change on it. When we talk about COVID, we're still in pandemic. Now, the people that are paid to figure all that stuff out, that's their goal, is to reach endemic state. And that's whenever we know we can live with it. So flu is something we've lived with alongside us for decades and decades, even centuries at this point. What has happened is we've greatly reduced the risk to so many because of the flu vaccines being here. The reality, though, is that a couple years, we've seen a reduction in the number of people that get flu vaccines, which again could create greater risk for some communities. Notably, the African-American, Hispanic communities that we see sometimes that maybe patronize and use your shops and salons. So it's really important we help get this information to you all so that you can help in your communities keep everyone protected.
So endemic means we've learned how to live with it. We're not going to get rid of it. We can live with it with the seasonal flu vaccine. Mike?
So is this the seasonal? So you're going to need the seasonal flu vaccine along with the coronavirus vaccine yearly as the future starts to come. That's what I'm asking you. So it's going to, you have to take a yearly corona and a yearly flu vaccine. Is that where we're headed to?
Well, I don't think we totally know the answer to that. We can speak to flu since we have a lot of data on the flu, and we know year after year that they reformulate these things and they put their best guesses into their flu shots. For the coronavirus, we don't really know what the future holds. We can only speculate at this point. And it seems like this is all. If you've gotten if you're up to date on your coronavirus shots now, I would probably lean to the side of there's probably going to be more coming. I would love to think at some point, some of these vaccines that you get, especially the childhood vaccines and some of the other vaccines you can get at your pharmacies, they put more than one thing in the vaccine. There's the one shot can protect you against multiple diseases. Okay, I would like to think that somebody out there that's in a laboratory and very intelligent is trying to figure out a way that maybe we can minimize the number of jabs someone needs to get and kind of multiply the number of things in one shot. And that would be a great win for everyone because, some people just don't like getting stuck in the arm with a sharp piece of metal. And I understand that.
Mhm.
If they're so identical in as far as what they do to a person as far as symptoms is concerned, they're so identical. Why isn't the coronavirus shot covering the flu symptoms, the flu as well?
So each one of these viruses are unique, and when we make vaccines, we protect against a specific virus. All virus, like, so you think about animals. There's a ton of different animals out there. They all look a little bit different, but you can use the blanket term animal to cover them all, from giraffes to kitty cats. Okay, virus is the same way. There's a big difference between a giraffe and a cat, but they're all under the same hat as an animal. The viruses are the same way. You say virus, but the coronavirus and the flu virus are the same as cats and giraffes. So we have to make one that will block each specific virus.
So Mike, look in the chat. Ask your question, but also keep your chat open because I'll drop some questions in there for you. But keep your camera on. There you go.
All right. So how transparent has the flu vaccine been to the public in comparison to how transparent the coronavirus vaccine has been to the public? Because I think in my community, it's all about the understanding and the relation. What's the relevance of the flu vaccine? How can we make that understandable to them without without telling them, oh, you need to get vaccinated, you need the flu shot? Well, why do we need the flu shot? Is the information accessible, widely accessible as it is as the coronavirus has started to be?
I think right now, Mike, that there's obviously more information, and it's been a higher priority to get information out about the COVID vaccine, just as the pandemic has been happening, and it's been front of mind for so many. The information on a flu vaccine and what it does or how it's made, it's out there. It's just not as recent. So there's a little bit of recency bias for us when we think about the information we know to it. But the flu vaccine, the Center for Disease Control, just like they provided us with so much information and guidance with the COVID vaccine and the information day to day and week to week, they have the same types of resources available to you. And they make that available as far as how the vaccines are made, the safety of these vaccines, and how well they work, as well as who's using it or getting it and where. And you can see that match up with lower cases of the flu then too. So we can see that it is not just safe, but it works. So that information is out there. It's just not on the front page right now because we're still in the midst of battling coronavirus.
Now, Mike, do the question in the chat, and then we're going to bring Sandra up.
Okay, let me find this. Is it safe to get a flu vaccine and cover at the same time?
Yeah, so you can get the COVID and the flu.
Let him ask the question again. Go ahead, Mike.
Okay. Is it safe to get the flu vaccine at the same time as the COVID vaccine?
Yes, actually, that's a great a great strategy, to be honest with you. We find that if we have people be like, well, I just want one today, I'll come back next week for that second one. There's a good number of people that never come back. So if they are there, if they are in our presence, in our chair, we want to maximize what we can protect them against right then and there. So yes, they can be definitely given together. There was some information right at the infancy of the COVID vaccine that says we should probably wait 2 weeks. They have backed off of that information, but like anything they say and they change, it just causes miscommunication. And people are like, no, I heard it the other way. They backed off that and they said, yes, we can absolutely give these things together.
So in actuality, when people are more scared, it's actually making your immune system super strong. Where when you take both of them together, huh?
Yeah, it does, Mike. One thing we like to share with people is that our bodies are amazing. So your immune system is certainly strong enough to work and build up immunity from 2 vaccines at one time. Just think about if we're running at the store or the public transit, anything like that, and you touch a railing, how many germs or different bugs you could come in contact with that? It's a lot more than 2. So given 2 vaccines at one time that are very targeted to help you specifically fight a couple bugs, it's certainly something that your body can handle and it is safe to do.
All right.
All right. Now, Mike, don't go far, but we're going to bring Sandra Jenkins up and we'll put Mike in the queue. Hey, Sandra.
Hi, good afternoon, everybody.
Here you are, one-on-one with the pharmacist. You've got the floor.
Yes. My question for you today is from a client who expressed a major concern of the fact that she got her flu shot a couple years ago. However, she got very, very ill. So therefore, she's afraid to even get the flu shot again, as well as getting the COVID-19 test. So she hasn't been vaccinated with either one. And she's very concerned about,
Sure.
possibly getting sick again.
Sandra, let me tell you what, we hear this a lot in the pharmacy. A lot of people come in and they say, you know what, I got the flu. I got the flu shot, and you know what, it gave me the flu and I was so sick. So the first way I handle this is the flu vaccine, it can't give you the flu. You might have some minor side effects because your body is mounting that immune response. So you could have a little bit of a fever, even a low-grade fever. You can have a mid-grade fever as well. You might just feel a little bit yucky, but you're not going to get the flu from the flu shot. That's not going to happen. However, it takes 2 weeks for the flu shot to actually kick in. So if you're around people with the flu, if you're like, oh man, my friends from church, they got the flu, I better go to the store and get my flu shot. And they come to see me, I give them a flu shot. And then 5 days later, they got terrible, crippling flu. Well, they probably already came to me while the flu shot was, where the flu virus was in them because of their friends that they were around with the flu. And it takes those 2 weeks for it to totally protect you against the flu. So I think some of these things do happen. The flu shots can make you feel a little bit yucky sometimes. That's totally true. They cannot give you the flu, but you might get sick right after you got a shot. And then that's part of the, oh, listen, I got the flu from this, and you tell your friends, and the next thing you know, everyone's like, nope, I know someone that got the flu. They got so sick from that flu shot. They might have gotten the flu. I'm not going to argue them there. They could have gotten so sick that they couldn't get out of bed for 5 days. That could very well be the truth, but it wasn't from that flu shot.
Understood. And another question is, with a weakened immune system, how does the flu vaccine impact someone who has a weakened immune system and possibly maybe just having a general cold or something like that? Should they still get their flu shot? Knowing that, yeah.
Two parts to the question, and let's start with the one that's just over the common cold. If you're currently battling something else, whether it be a common cold, oftentimes it is desirable to wait a day or two. However, if you're there and that's your only opportunity to get a vaccine, it is better to be vaccinated. And the reason we say that is because a shot is better than none. But if you're feeling a little bit under the weather, you might be a little bit less responsive with your immunity from the vaccine. But I think an important thing to remember with that is that getting a vaccine, as we know, does not put you in a bubble and make you completely, Superman from any virus. what it does do is helps your body have a head start at fighting that virus. And that means you are less likely to have symptoms and a shorter duration to it. So
Mhm.
say shorter duration, most people that get a real flu infection, they have symptoms for about 5 to 7 days that can be pretty significant, including fever, some heavy cough, and definitely ache and fatigue. When you have people that get a vaccine, that is normally lessened in severity and time. So to your earlier question then about having getting sick from the shot, oftentimes we see side effects to the vaccine being only a day or so. I always like to talk to my patients when I'm with them and say, if your arm hurts, that's because I put it in the right spot. If you're a little tired or have flu-like symptoms, that's because your immune system's working for you. So we're not afraid of that. We're happy to see it. Just know it's a little bit of an inconvenience to protect you long term.
Mhm.
Sandra, to the first part of your question you just asked, are immunocompromised people, people that are already at greater risk, are they to get a flu shot? Absolutely. Their response might not be as strong as someone who's 30 and healthy, but we do want them to get a flu shot because, again, they're the person that needs a head start to fight off the flu. And that's why we can do that with a flu vaccine.
Mhm.
In fact, we even have specially formulated vaccines for people age 65 and older that deliver a higher dose or have a little extra component and ingredient in it that helps your immune system kickstart on it. So that is our way of helping some of those at-risk people get a better response so they're even more protected from the flu.
Mhm. Okay, so some folks are wondering, what is the difference between the flu shot and COVID-19 shot? If I have my flu shot already, why should I even get my COVID-19 or vice versa?
Yeah, that's going to go back to how I was talking about the drafts and the cats. Um, every virus is a little bit different. We have a lot of different vaccines out there. Just when you take children to the pediatrician, they got a list of things that they need to get injected to them to save it to protect them from the mumps, from the measles, from hepatitis, to HPV. There's a whole bunch of things out there that we protect folks with. And let me tell you what, if I could figure out how to give you one shot that takes care of all these things, I would be a billionaire. But at this point, you've got to formulate your tools against these one by one, and the vaccine that covers you against COVID does a great job of identifying COVID. Does not a job at all against flu. It doesn't recognize the flu. It won't help you make antibodies against the flu. You need that specific flu shot that's made up every year to go out and specifically pick up on that flu virus.
Okay, very good. And the next question would be for folks who are 65 and older. I do recall you mentioning something about that. However, for someone who is 65 and over, who may be, on the path of getting their vaccines and doing what they're supposed to do because they're being cared for by their primary care physicians. However, the caretaker, when they're in the presence of an elderly person that has been vaccinated and they have not been vaccinated, what is the likelihood of possibly, infecting that elderly person?
I want to make sure I'm understanding this correctly, Sandra. So you're asking if I had the vaccine, do I have a risk in transmitting the virus to someone that is at risk but unvaccinated?
That is vaccinated.
That is vaccinated?
That is correct.
So from the vaccine alone, no. And essentially what it means is the reason we get the vaccine is, again, it jumpstarts our defense against the virus. So if I were to come in contact with the virus at work or shopping or otherwise and contract the virus, having had the vaccine, I am less likely to have significant symptoms.
Mhm.
I am less likely to have significant symptoms, then that means I'm not coughing, sneezing, and producing those air droplets
Yeah.
that can pass it on whenever I go visit my 90-year-old grandmother. So even though she's vaccinated and I know she's at higher risk, my vaccine helps to protect her.
Mm-hmm.
Possible that there could still be a transmission?
Mm-hmm.
Truthfully, yes, there is. But the reality is that my vaccine reduces that likelihood and the severity of my symptoms. And her vaccine gives her a head start on fighting that virus should she come in contact with it, even more reducing her risk of symptoms. And at 90 years old and some of her health conditions, staying out of the hospital and being around for Christmas.
Yes, understood. Are there any long-term health problems from the flu? And does the flu damage heart or your lungs? Or can it damage your heart and lungs?
So I think to that, the flu virus directly does not cause damage to organs. And I say directly and emphasize it because what the flu does is can give you a lot of congestion and fever symptoms and weaken your body during that week period, that 1 week period. And what that does is makes your body an opportunity for a bacterial infection to follow it up. The most common of those is pneumonia, which is a significant respiratory or lung disease that can lead to hospitalization for many at-risk people. And it's why we do a point of emphasis for those that are at greater risk of complication. So those that are older, over 65, or those with some pre-existing conditions. Those are the ones most at risk to develop those secondary infections. So not having the flu virus be their biggest problem, it's what comes after it while our body's weak trying to fight it off. For those that aren't at risk of complication, the flu vaccine for them means that they're helping to protect those loved ones and family members.
Mm-hmm. Very good. And the impact of the flu vaccine on children, infancy, till the 18 years old. What is the importance of children getting their flu vaccine annually? Can they skip a year, or is it required every year?
It's not required. Or, I mean, it's not required by law. But if my children, I make sure they get in there every year and get their flu vaccine. All right. Depending on your state and your state laws, you might have to go see your pediatrician, or you could come to the pharmacy in a lot of states at certain ages. Mm-hmm. Like I said, every year I make sure that my kids get their flu vaccine. Now, what I find is, yes, children are a little bit more resilient, assuming a healthy child up to 18 years old with no pre-existing conditions or anything. They're relatively healthy. The flu, it might affect them, make them sick, make them feel miserable, but it's not taking a lot of these types of folks to the hospital. Mm-hmm. Problem is, whenever the grandkids have flu and they go see grandma who has diabetes, who has asthma, who's a smoker maybe, those types of situations that are already there in grandma's health condition, and if she's not vaccinated and my grandkids come over and they're not vaccinated, they are just carriers of this flu vaccine. It can cause a situation that grandma might end up in the hospital, and we don't want grandma in the hospital.
Exactly. And that is incredibly important. And there's one other question that someone asked: what is the importance of staying hydrated? Keeping hydrated. The importance of the consumption of plenty of fluids during the period of your flu vaccine. Someone mentioned that they felt very sick and they felt dehydrated, weak, they were fatigued afterwards. Could you provide any recommendations on how someone should care for themselves, in the event they experience those side effects?
Yeah, I could touch on that, Sandra. So your question is about, as a side effect of the vaccine, that maybe 1 day or so feeling where you have what we call flu-like symptoms, but it means that your immune system's kicking in.
Yes.
And, hey, go lay down, be tired, be a little bit achy. I got work to do in here. What happens with that is some people, if they're not careful, they can get more as they're lying and resting. They don't take care of themselves and hydrate or eat, and they can become dehydrated. And then that becomes a separate effect to it. Now, that can even be more of a concern for patients for if they have underlying health conditions. So I'll use a diabetic as an example. If a diabetic were to have some of these expected and comfortable side effects, flu vaccine, and then does not continue to hydrate themselves or eat properly, that can cause a bunch of fluctuation in their blood sugar. And that put them at greater risk for some short-term problems on it. So it is helpful to try to stay regular and routine when you get the flu vaccine. Maybe plan it if you're able to for a day that you can rest the rest of that evening or even the next day. But most importantly, just stay routine and try to not break stride too much, because we want to keep regular with our normal diet so that we can get back to normal quickly and without any complication because of some underlying conditions.
Very good. So in the salon, how could we promote more of an awareness of the best practices in the salon that we can partake to identify, those clients who may be experiencing symptoms of the flu? How could we protect ourselves and also, the community at large?
I think in getting ready to meet with everyone here, I did some research. I took a note from Dr. Quinn, Dr. Thomas mentioned earlier, and as healthcare providers, we're always stuck on just trying to give you good news, good news, good news. Here's a pro, here's a pro, here's a pro. Get your flu shot, get your flu shot, get your flu shot. And I think in the salons and shops where you're uniquely positioned is that you're able to help overcome some of the barriers, the questions we've been talking about today. And again, stop the misinformation, but encourage folks, whether they're the at-risk person or not, to get their flu vaccine. And after that sincere encouragement, hey, I want you to have your flu vaccine because it keeps you safe and it keeps the next person in the chair safe and it keeps your grandma safe and it keeps your neighbor safe. And here's what I learned about it to help you know that it's okay. It's about overcoming some of the negatives more than it is just throwing all the positives out, because we've had some misinformation. And when there's so much information on social media right at our fingertips, it's tough to get through that. And that's where I think the trusted professionals in our shops and salons really can shine through and make a big difference for us.
Thank you.
Ken, that's a really, really good point. Let's bring Mike in and we'll open up the conversation. I really like how you've acknowledged and recognized the key role that the barber and stylist play as trusted individuals with relationships, that they can actually spend time unraveling the misinformation. Sometimes in public health, we say association is not causation. So you got the flu shot and you got the flu. You think the flu shot gave you the flu, but you had you were infected before you got your vaccine. So are there other examples, metaphors that you use when you're explaining these kinds of things to people that you think work? You've used some of them, but are there any other metaphors, analogies that you as pharmacists use to help people understand why they need to do this every year? And then I'm going to be interested to how Dynamite Brown and Sandra Jenkins think about those metaphors and analogies. Ken, you want to start first?
Sure, thank you. One thing I've used before is I talk about alphabet soup when it comes to the flu vaccine, because that flu virus, like we talked earlier, there's a lot of different types of flu viruses out there. We put 4 of our best predictions in every season's flu shot, and that can change year to year. Now, the exact letters, how that word's spelled for that flu virus that year, I can't be sure. But if I can give you protection against 15, 16 letters, maybe 20 letters because of the ones that we picked, no matter what flu virus you come in contact with that year, you're going to have some protection against parts of it. And that's going to reduce your symptoms. So you're not going to feel as bad and it's not going to be as long. And again, that keeps you out of the hospital or away from things like pneumonia. And that's it's safer, so you reduce your risk of passing it on to loved ones too.
Alphabet soup. Hey, Sandra and Mike, you think alphabet soup can help?
Yeah, yes. Especially
Um,
the ones.
Yeah, the for me in the community that I serve, they're skeptical about everything. My suggestion would be to you guys, as far as dispelling the myths in the community is, you know, when the vaccines are talked about, they're always exposed in a savior. It's going to save you. It's going to do this. It's going to. Nobody ever says that this one person had a little fallout. I mean, every trial had to have somebody who got sick. They never talk about that. And so they're always cheering about how many people has helped, but they never address that the one person that could have slipped through the cracks, fell between the thing. They never addressed that to some people. Well, let me explain that to this person who had this type of ailment, was reluctant to this, helping them to see that, you know, this, we're all human here, it's not the savior of the world. It's helping predominantly everybody, but it does have some risk. And I think if they just touched on those, the downside of it, the possibilities, I think that would increase the belief in the people from my community to believe in the system more, because at least they're pulling the blankets all the way off the bed, and you can see that the sheets are not made underneath when you pull the comfort off. And that's what we want to get. They want to be, we want transparency. We want to be able to see. And if you could just talk about those things that did happen, unfortunately. I know you want to have the vaccines because they do help the community. Predominantly, it's predominantly safe. But those people that fell through the cracks, I think, needs to be addressed to give it more validity that it's a vaccine that does have a side effect. It could have a side effect, but for the most part, it's going to do this for you.
Mike, I think it's a great call out. It's a fair call out to it, and it is probably too often a miss for when healthcare professionals get to talk in these community settings like that. The reality is that there's risks with anything we do, and the truth of it is, though, that a lot of when you go to a healthcare professional, and it's easier now than ever because you can walk into your local pharmacies as well, there's questions that we ask. And some of those questions on the surface seem kind of, okay, whatever, circle yes or no. But to the trained professional providing that service, it tells us if you are at an increased risk for it. And we know there's always going to be exceptions to that. Someone could have an allergy to a component of a vaccine. Now, over the decades, they've tweaked those formulas to get away from some of those products and reduce that risk and that likelihood for people based off of the information we knew. And there are times where people can have some negative side effects to it beyond that flu-like that we're talking about. They are so infrequent, though, when we look at the millions and millions of people that receive a flu vaccine every year, that we don't want to highlight it so much, but we do take the time and our responsibility to everyone that comes into our chairs as a healthcare professional is to make sure they understand that there is risk with it, but also that they know we have asked those questions with purpose to review their specific, them personally, to know that this is, by all accounts that we can tell and predict, going to be safe for them. Now, we further that just by letting everyone know too, and this is maybe something we could pull back the curtain a bit more on, we're all trained not just to give the shot, but to respond and help you should something bad go wrong. So when you get that shot, you want to stay where you're at in that pharmacy, in that health clinic, in that clinic setting for about 15 minutes, because the most severe problems happen in that first 15 minutes. And the same people that are giving you that shot in the arm, they're trained to help you get through that too and be safe through it. So that is some things that we do, understanding that risks are there, understanding that people have had significant reactions, but really just trying to be fair and honest about it. We ask the questions to assess that risk, and then we make the best decision for you and talk to you about it. And I think that's where, again, if I can draw the parallel as being the most accessible healthcare provider in the pharmacy, we get a chance to talk to people in our community and more each day than maybe having those structured appointments that we see in some other settings.
Mm-hmm.
You know, Blake, we had an alphabet soup analogy. I'm going to give you a chance to put one of your analogies or metaphors that you use. What do you use out
Dr.
there?
Thomas, I'll give you my secret sauce. I guess I don't have anything as clever as the alphabet soup, but what I do is I like to be real. I like to be real with the people that come to they don't want Mr. Farm D, listen to me, I went to school. They want Blake, their pharmacist that they've known, that Blake says, hey, how'd your soccer game go to the little ones when they walk by on a Saturday? They want me to speak them true. And sometimes when they talk to me about the flu shot, I'm like, you know what? I've gotten a flu shot before, and you know what? I got the flu that same year. But you know what? I didn't go to the hospital. I felt like garbage for a couple of days, but you know what? I didn't end up in the hospital. I'm fine because of it. But I want to be honest. And I was like, you know what? Sometimes when they make those guesses, we talk about every year how they make guesses. Sometimes I guess better. The alphabet soup tastes a little bit better on one year, according to then the next year it might not be such a great batch of soup. But it's the truth, and I like to tell the truth. And now I also like to say, listen, I hear you. I hear what you're saying. I hear your hesitancies about this vaccine, whatever vaccine they're asking me about. But here's the truth: the disease. If you want to look into the 1 or 2 cases here of something that went terribly wrong, not getting the vaccine, there's a whole bunch more data that says, hey, these things do go on for the people that don't get vaccinated. And let me tell you what, I put this vaccine in my wife, in my mom and my dad, and my children, because I believe in them. And those are the people I love most. And I would not put anything in your arm today if I wouldn't be ready and willing to put it in the people that I love most arm.
Mm.
Okay, Sandra, how's that metaphor work?
Well, that was excellent. That was excellent, Blake, because we're on the same page. As a trusted partner, of a Walmart pharmacy and other pharmacies that my clients relate to, I hear them all the time. They know who their pharmacists are. They're the ones that provide the medication. And to me, it sounds like the vaccine is somewhat a preventive measure in terms of having to consistently buy over-the-counter meds. I mean, there are clients who will medicate themselves, and they'll bypass their pharmacists, and buy their own medication to treat their colds or their fevers or whatever, or maybe their flu, for that matter. So to know that, the vaccine is another avenue where it can actually be somewhat of a preventive measure, and having to consistently buy these over-counter meds and to probably get the cold or the flu, more common than you would if you did not get your vaccine. So that is what I pretty much take from this, Blake.
So we're almost to the end of our show. And what I wanted, I'll do it this way. I'm going to ask Ken and Blake, are there questions you were anticipating that you haven't heard yet that you want to, for the record, respond to? Blake, I'll let you go first.
Anticipating, I think most of the ones that I anticipated, yeah, I think everything that I was kind of thinking what I might hear, I think we covered most of those things. I know that I get asked a ton of questions on a day-to-day. A lot of them are a lot of the things that we talked about today. I can't think of anything that is a glaring. Oh, eggs. Some people are like, I have a terrible egg allergy, and people say they make those flu shots with eggs. So there is a specific flu shot. There's different types of flu shots, and people, you know what? Maybe there's something in the chat about the different types of flu shots. There are different types of flu shots, and people ask me sometimes, what are the difference between those? Eggs being one of those. One's ache-free. The one for 65 and older has got a little more oomph to it. As we age, our immune system's not what it used to be, and we need a little bit more to kickstart our immune system. So that's a difference between the 65 and older flu shot and the ones for the folks less than 65. They as long as you're not, if you're 65 and older, go ahead and get that one with a little more oomph. If you have an egg allergy, there's one for that. But if you are less than 65, basically, and over 18, and any flu shot, basically, of the ones that aren't formulated for over 65 would be a fine guess or a fine choice for you.
Very good. Ken?
Just to add on, if you've got younger children too, all the way down to 6 months, it's the same flu shot for most people with it all the way through the adulthood. So I think not a question, Dr. Thomas, but something that I'm always surprised when someone reveals this after getting a flu shot is they reveal how easy the process was, because there are so many places to get a flu vaccine now, and it's covered with most insurance, but nearly all insurances are covering it. So it's not just getting a doctor's appointment and waiting the weeks for that appointment. You can walk into pharmacies on every street corner and get your flu vaccine without appointment. There's plenty of healthcare centers, departments of health, whether it be county or state level of it, that will offer clinics or walk-up service to it. And I think that's the one thing that is always telling to me is just how surprised people are day after day, year after year, at how simple of a process it is to just go ahead and get that vaccine.
Well, I think I can say without risk of contradiction that the folks in the shop are going to want to look for Blake and Ken as their pharmacists, because you brothers really break it down. You make it inviting. I'm going to give it to Sandra and Dynamite Brown for closing comments. Dynamite, we'll start with you, and then we'll close out with Sandra.
You guys are amazing. The way you're able to relate. I know you could come into our establishment and get the message across and knock it out the park. Just so glad to be able to chop it up with you guys and be able to learn from you. Thanks a lot.
Sandra?
Yes, and I like to say I'm very, as I stated in the beginning, I'm elated the fact that Kenneth and Blake could be here with us today and to share this valuable information. I'm pretty sure that the staff members will greatly appreciate it and take something with them from here on. This is a very important subject topic, and I think we need to continue this discussion. Thanks again.
And Ken and Blake, what I've learned is that there are silver linings to this pandemic, and we're in one of them right now. And that is to bring the two of you into a Zoom room with barbers and stylists, to stream it live on Facebook, to have a post-production where we can put it out on social media. And most importantly, for the people to see your personalities as pharmacists, and not be afraid when they come up to that window. I think that's great. And there are a number of things that we can do to simply demystify and make it okay. When people say, I didn't know it would be this simple. Well, let's get them to go out and celebrate that and get more people to overcome their hesitation. Meg, before we close out, anything? Are we good?
We are good. These videos will be kept live on Facebook. So I will send you the links afterwards.
All right, some snaps for our guests. Thank you very much.
It was an honor. It really was an honor. This
snaps
is
for what you
warmed
all
my
do
heart
here.
to be part of this. So thank you all. You get some snaps from us.
You're
All
welcome.
right. See
Thank
you
you.
next time.
Thanks, everyone.
Bye-bye.
Bye.